everyone. Welcome back, or I should say, welcome in. Thank you for being with me. This is another edition to make sure your practice is always thriving and growing. Thank you to ChiroSecure. This is your coding and billing expert, Sam Collins. And this edition, I want to focus in on some of the active care and therapy codes that I think are often very confused. Like, by example, have you ever thought of what is the difference between like manual therapy massage? Or today, what we're going to focus on is what is the difference between therapeutic exercise and therapeutic activities? How are they different? And for those of you who've been around a while, you can remember when we didn't have a therapeutic activities, we called it kinetic activities, and they updated. So what are the differences? Let's go to the slides. Let's start to give you some information that hopefully you can take. So the therapeutic exercise and therapeutic activities have a lot of similarities, but they are different, and one has a much higher value. So let's kind of focus in on what we're looking at and why. And you've heard me talk of this before, but I want to focus in on active care. Chiropractic, number one, is the main thing to deal with low back neuromuscular problems, but coupled with exercise, according to best practices, is always going to be the better resource to make sure your patient gets the best outcome. In addition, it's less problematic than dealing with passive care. So if you're focusing a lot on the massage and manual therapy, that's great during the acute phase. But what about beyond that? What about dealing with a separate area? That's really going to be the problem many run into. So I want to give you a focus here to look at this differently and focus in on what's good for your patient, but also good for your practice. So take a look. On the left here is from the Cigna Policy for Chiropractic, Cigna Policy 278, and it says, the provider should attempt to integrate some form of active care as early as possible. In other words, what they're saying is you should be doing active care things as quickly as you can and de-emphasizing the passive. Not to say that passive is not having some merit, but the bigger factor is the rehab, the strengthening. And so they're saying right here, do it as early as possible. In fact, in the second paragraph, notice it says the utilization of passive modalities is considered not medically necessary, because the service is just during the acute phase. Anything beyond that becomes problematic. So let's focus on active. In fact, here's what I will tell you. What the insurance is essentially saying is, don't bill the passive therapy that is, one, worth less money, less effective in the long term, and you have to have the whole separate area business. Active care doesn't. In fact, if you look here in the middle, this is from EviCord. If you go to the fourth bullet down, it says as treatment progress, one should see an increase in the active regimen. And even under here, under the State Farm regulatory, it says the same thing. Range of motion and muscle re-education exercise to restore appropriate muscle control and support the cervical region in patients with acute whiplash disorder. So again, the focus on the exercise or the rehab side of it. So what are these active care codes? Well, there's 4, but I want to focus in on 2 of them today. Therapeutic exercise, 97110, and therapeutic activities, 97530. And what are the differences? What are the nuances? And I think this is where most people are confused. I've taught seminars now for 25 years. I've become the expert when it comes to coding and billing. State boards, insurance companies, the VA all contact me. So I want to pass it on to you and say, well, what is the difference? Because I think we lack a good understanding. Think of it, during your PT course in chiropractic college, which was 120 hours, did we really learn this? I would say for the most part, not really. So we have to do things above and beyond that. But here's the problem. You ever watch the show The Bachelor? I'm embarrassed to say I've seen a few episodes, not many, but I've seen a few. And you'll notice on the show, it's confusing. So one time when I was watching the show, I was thinking about CPT codes. I know, sounds weird, but I realized they're the same. You remind me of the CPT codes of The Bachelor because you tend to be ambiguous and overlapping and not clear to what your intent is. If you ever watched The Bachelor, you know what I'm talking about. That being said, by example, the confusion here is, look at what this person is doing. Now you can see they're in a PT clinic, notice the tables and all the therapy, and she's doing that rope exercise that's very popular now. Now, what would you say she is doing? What would you determine that to be? Would it be a therapeutic activity, 97530, or therapeutic exercise, 97110, or neuromuscular education, 97112? Which do you think? The reality is, it potentially could be any one of those because the purpose is more about the code. If the focus is on just strengthening, it would be exercise. But if the focus was on a functional activity because her job requires her lifting things, it becomes a therapeutic activity. So think of the functional side makes it an activity, If it's just for strength or flexibility, exercise. Neuromuscular education, we'll talk about that in another class, but would be, for instance, balance coordination. So the difficulty is you could have someone doing this and then another person doing the same thing, yet they could be coded differently based upon the purpose of it. So let's talk about exercise. 97110 says this procedure includes instruction, feedback, and supervision. So one-on-one with the patient, making sure they're doing it right, making sure you're following up with them, doing the proper positioning, getting the full effort, and then supervising for exercises for their condition, including to maintain flexibility and muscle strength. And that's pretty much it. Think of it going to the gym. What am I trying to do? Get stronger, get more flexible, maybe build more endurance. And this could be in a lot of different ways. It could be completely active, where the patient's doing it on their own, you're supervising, or active assisted, where you're helping, or passive, where you're just stretching the patient. It's considered medically necessary for any loss of motion, strength, functional capacity to extent, but it's more about increasing just strength, flexibility. Now, be careful. Exercise should not be used or coded just because a person goes in the room and works out. It's got to make sure that there is an active portion with you or staff that's actively supervising it to make sure it's done properly. So exercise is just what you think it is. Strength, endurance, range of motion. So a bike, a treadmill, gym equipment, weights, isotonic, isometric, and so on are all going to be exercise. This could include simple stretching like you see here. Maybe someone has upper cross syndrome. Or how about doing something like this? Is from our friend Web Exercises. But look at these ones, the Brugers, the head retraction, the floor angels, or the Blackburn T. Think of how many people have difficulty where if they stand against the wall, they can't fully bring their arms back and touch. Most can't. We should. Why do you think most people have upper back pain? That particular syndrome. So doing these exercises are to restore that. This would be certainly exercise. And how about documenting in this way? Because it's in the chart, it's easy to see what you've done. Just indicate the sets and the reps. Because for documentation purposes, how do I document exercise? Well, let's take a look at what an insurance has said about it. And it says here, to be formally addressed, the proper utilization of these codes requires that the daily treatment documentation include the specific body part. What am I treating? Low back, neck, whatever. And the type of exercise rendered, whether it's weight training, therabands, but you want reps, sets, if it's aerobic conditioning, in other words, describe it. And along with that, the time. Now you'll notice here it says actual clock time, which is fine. You can say I went from 5:15 to 5:30, but you can also put I did 15 minutes. What you do have to have is the time that's face to face with the patient. And remember, the 8-minute rule does apply. So exercise is pretty straightforward. Strength, flexibility, endurance, and it can be almost all of those factors kind of combined. How about, though, what is therapeutic activities? How's that different? And this is where I think the confusion is. The definition, as it's written in the CPT manual, says therapeutic activities is direct one-on-one patient contact, the use of dynamic activities to improve functional performance. So here's the thing, a dynamic activity is going to be exercise-like, but it's more with the outcome. So it's really the design of the program and the purpose of the exercise, if you will. The reality is a therapeutic activity for the most part kind of an exercise? It is. But it's an exercise very specific to deal with a specific functional deficit of an activity. So meaning a person lifting a box from the floor. By example, if I just have a person doing a deadlift because I want to strengthen their low back, I'll say exercise, I'm strengthening low back. But if the purpose is to have the ability for them to do that task, to lift things from the floor, it becomes an activity. And the difference is really by design. And if you think of it, I would bet most of you probably are doing more therapeutic activities than you are exercise. But I'm not trying to talk you into it. I'm just saying chances are you're designing something specific to your patient and their needs for their life and lifestyle. So the procedure involves using functional activities, bending, lifting, carrying. Sometimes you hear them say the ing things. Well, weightlifting is that. I'm doing curls, but again, it's more the task orientation. So therapeutic activity says it involves the use of functional activities, bending, lifting, reaching, carrying, and so on, to improve functional performance in a progressive manner, much like exercise, but it's a performance. And they're directed at a loss of restriction mobility or an inability to do a task. It should be appropriate after the patient has completed exercise. And now one thing to think of it, in a way, exercise kind of leads to a patient being for more functional activity. Potentially the exercise is to stabilize it just enough to be able to begin to do a little bit more. So it's more about the functional end of it and that specific outcome. So if you're documenting a therapeutic activity, the documentation and the idea is more about what is the functional outcome you're looking for, not just, oh, I want the hamstrings more flexible, but I want them more flexible so that I can touch the floor and pick up an item from work or home for that matter. So by example, look at all these different types of things that a person is doing here. Would you say those are exercises or therapeutic activities? It depends on the intent of the task. For example, think of it this way. Do an abdominal curl. Simple abdominal curls can be used for strengthening weak abdominal muscles. The person has low back pain, their abdominals are very weak. Okay, I'll say that is exercise. However, what if they're doing it because this patient, because of their weak abdominal muscles, they literally cannot get themselves up from a lying down position. They have no strength there. So the abdominal curls are more designed to get them to be able to raise themselves up from a lying down position. That changes it to a functional activity. So if you think of it, functional activities are more about give me something unique for this patient that you're trying to have them complete certain tasks or tasks. The best practice to determine is what the functional outcome that you're expecting. Is it simply strength and flexibility or one with a functional outcome? I would give an example. What if you had a person with carpal tunnel and you have them squeezing a ball because they have weakness in the flexor muscles? Okay, I'd say that's exercise. Now, what about a person, though, that they have a job where they have to lift items and grip them to pick them up? You're now doing that same ball squeezing, but it's because you want them to grip to lift items. That makes it kind of the activity part. So think of it by design. That's why it's worth a little bit more. Differentiating between the two, think of the exercise as probably a path, as I discussed. Generally, exercise starts, therapeutic activities finishes, I would assume, because you're trying to do something specific for the patient. It's not a generic one size fits all, everybody gets the same thing. I'm pretty sure you're designing a little bit more. And for that reason, there's a difference in value. Notice the relative values. Now, relative values are simply a number that tells you the value of one service compared to another. So by example, you'll notice 97110 has 0.87 and 97530 has 1.10. So what is that telling us? There's about a 23% difference, or let's just round it to 25% difference between the two. In other words, if my fee for 97110 was $50, my fee for a 97530 would be about 25% higher, or about $12 to $15 more. Now, to give you a relative term of it, look at the value of an adjustment. A value of an adjustment, 1 to 2 regions, is 0.81. So notice even exercise is slightly more than the 1 to 2 region adjustment. Now, a 3 to 4 region is a little bit higher, but you'll notice here, there should be a difference in price. Now, you might think, well, how does this help me? Well, my concern is sometimes offices bill fees that make no sense. So looking at this chart, if you're saying your adjustment price is of $50, I'm just picking that fee up, what should be the value of 97110? Well, roughly about 6% more. Not a lot, but probably $53, $54. Comparative to, notice the difference of 97530. In fact, I would say 97530 is about the value of a 98941, which again is usually about a good 30% difference. So to give an example, let's just take a look at Medicare rates. So this is a standard average Medicare rate for the three services. Notice 98940 about $30, but notice 110 32, 97530 41, so substantially more because it has a higher value. And if you think of it, doesn't it make sense that a functional activity would have a higher value? Think of the design, the purpose. A lot more goes into that. I mean, exercises, give them a sheet of paper and follow them and make sure they're doing it safely. But a therapeutic activity is something that you've really taken the time to design that really focuses on your patient's individual needs. What I will say is, I would bet and I hope that you're doing these services regularly. This is what really is going to get the patient to really resolve and rehabilitate to not have it happen again, or at least minimize it. Not just massaging it, which has to be a separate area. Rehab it. Focus here. And if you think of it, has anyone ever told you, man, I did 15 minutes of exercise and I'm in really good shape? Probably not. That's why most physical therapists generally do no less than 45 minutes to an hour. I'm not saying do that much, but what about 2 units? Would that be reasonable? In most instances, yes. And quite frankly, I just showed you, you're going to get less pushback. So why are we fighting as a group for this passive care when in fact insurance companies prefer and want the active care, which pays more, has better outcomes, and less issues with separate areas. So start to think, how am I running my practice and how am I using the proper codes? But I'm certainly going to say rehabilitation. Now, this is something you can be part of this all the time. We offer a service they call the network, and I'll say go to our website, HJ Ross, look at our news section, updates on chiropractic reducing healthcare costs, a really good article there. One about the one leg standing. Are you incorporating that to your exam? Join and be part of our network. Take a look at our site. We can give you the full help with seminars and more than just this. You can call and email me with all questions. We want to be a resource to help you. ChiroSecure is always going to be your risk management. HJ Ross is the place to go to make sure you're getting paid in full. So I'm going to thank you all for being with me. I will say next week's host is going to be Mark Student. So until a few weeks away, I'll see you again, my friends. Take care.